Hello, my name is Nettie, and today I will be talking about insomnia, an issue that many of us Americans go through on a daily basis. As we go through our schedule, I know many of us have realized that people come up to us and they say, I'm really tired today, I didn't get enough sleep last night, or I need a cup of coffee to get me through this. The Sleep Disorders Take Them Seriously article states that 100 million Americans function with impaired daytime alertness because they do not get the sleep necessary throughout the night. Berman, Nino, and Rower state that Americans experience sleep-wake disorders because of shift work, jet lag, and similar disruptions of the biological clock. When many people hear the word insomnia, they associate it with not being able to fall asleep during the night and needing a cup of warm milk or maybe some hot tea to fall asleep. Insomnia also includes not being able to stay asleep throughout the night, and it involves not being able to go through the day without feeling the need for a nap, and sometimes a nap will not help you feel rested either. The Harvard Special Health Report says that although it's the most common sleep disturbance, insomnia is not a single disorder, but rather a general symptom like fever or pain. Finding a remedy requires uncovering the cause. There are short-term insomnia, there is chronic insomnia, there is also learned insomnia, and advanced sleep phase, just to name a few. I will go through and explain these to you as the article Insomnia Improving Sleep describes them. Short-term insomnia is usually what many Americans go through, which includes sleeplessness for 1 or 2 days, maybe even a week. Then that moves on to learned insomnia, which associates your bedroom with a sleeplessness environment and therefore allows you to be insomniac for more time than the short-term insomnia. To illustrate the learned insomnia, I quote the Harvard article. It says, as insomnia worsens, anxiety regarding the insomnia may also worsen, leading to a vicious cycle in which fears about sleeplessness and its consequences become the primary cause of the insomnia. Chronic insomnia then occurs after the learned insomnia and the short-term insomnia cannot be dealt with. Then Sonia Ankali explains that people with advanced sleep phase syndrome are usually over the age of 65, and the older that we get, the less sleep the person gets, which therefore associates why older people are always awake earlier. It is not necessarily that they want to be awake, but it is more that the body does not allow them to sleep past certain hours. The article, How Well Are You Sleeping?, provides a helpful tip for napping. It explains that the American Academy of Sleep Medicine recommends napping before 3 p.m. and for no longer than an hour, so that it doesn't interfere with falling asleep at night. Now, there are about 4 ways of treating with insomnia, as Help for Insomnia explains. There is sleep hygiene, which includes only using the bed for sleep, exercising as much as 30 to 45 minutes of subtle exercise, eating properly, and having a comfortable bed. There's also behavioral therapy, which includes relaxation training, sleep restriction, and cognitive therapy. The third would be supplements, such as supplemental vitamins, and there are medications which should be used sparingly and for worse insomnias. As Patricia Waldron says in her Memories Without Counting Sheep article, as anyone who has ever pulled an all-nighter knows, information that one tries to cram into the brain in the wee hours of the morning never sticks as well as material studied earlier at night. Sleep deprivation or insomnia can cause us to lose many things in our life and cause us to do bad. But Sleep Disorders explains that from 2 to 7 a.m., increased sleep tendency and diminished alertness occurs. And Ms. Sonia Ankali also says that although many people use alcohol in order to fall asleep earlier, it really doesn't work as well as it should because it helps you feel sleepy, but then throughout the night you'll be waking up. She also explains that caffeine increases sleep latency, the amount of awakening during the night, and the amount of time spent awake during the night. There is also an article of real-life examples, which is named How Well Are You Sleeping? This one gives you many examples of how people have ignored their insomnia and have had negative effects because of it. Insomnia should not be ignored, even if it is a mild kind of insomnia, such as for short-term. And it is never too early to begin setting up a proper sleeping habit for yourself. Thank you.